Frailty, defined as the decline in physical and cognitive reserves leading to increased vulnerability to stressors, is associated with adverse postoperative outcomes. Regardless of age, frail patients undergoing surgery have an increased risk of adverse outcomes, such as loss of independence and increased risk of mortality. Thus, preoperative screening for frailty may be useful to predict the outcomes of surgery. However, traditional tools for identifying frailty, such as mobility, strength, or computed tomography, are not optimal for regular use in clinical settings. In this diagnostic accuracy study published in Anesthesiology, the authors identified whether point-of-care ultrasound measurements of the quadriceps muscles can be used preoperatively to discriminate between frail and non-frail patients and predict post-operative outcomes. 32 patients scheduled for various types of surgery were included. Frailty was assessed using the Fried phenotype assessment, preoperative ultrasound measurement of the quadriceps muscles and rectus femoris, and computed tomography of the psoas major muscle. Post-surgical outcome data and complications were obtained from medical records. Results showed that quadriceps depth by point-of-care ultrasound and psoas muscle area by computed tomography were able to identify frailty defined according to the Fried phenotype assessment. Quadriceps depth was associated with adverse post-operative outcomes, such as discharge to a skilled nursing facility and delirium. Fried phenotype assessment and psoas muscle area were associated with all-cause 1-year mortality. Preoperative ultrasound measurement of quadriceps depth shows promise in discriminating between frail and non-frail patients and predicting post-operative outcomes. However, additional studies are needed to validate the clinical utility of this approach and clarify if these associations are independent of potential confounders, such as surgery type.